According to the Gun Violence Archive, there have been 163 mass shootings in the first 15 weeks of 2023. That's an average of more than 1.5 mass shootings every day so far this year. Social pressures, bullies, academics, gun violence on top of all that, right? These are all things that generations of American children have had to worry about.
Yeah, today their parents are telling us another weighs on most of them too, as we're talking about the perspective of gun violence. A new poll shows 77% of parents of school-age children are worried about this issue now. And joining us live to talk about the concerns, psychologist and award-winning author, Dr. David Swanson. Doctor, I really appreciate you being here this morning. I saw this polling come out over the weekend, and we actually had an incident at our house where I went to throw a dinner party, and I put my future stepson, who's just 8, at the end, closest to the door, and he said, "I don't want to be near the door because I'm scared someone may come in." He's so young. To hear him actually express this was devastating to me, but it's weighing on young people's minds. How do you talk to your kids, especially when they're so young?
Yeah, I think there's a big difference in terms of how you're going to speak to the older kids versus the younger kids. Obviously, when they're a lot younger, safety for them, the feeling of safety or perceived safety is the primary issue here. And so you want to reassure them that they're safe. And that goes a long way for younger kids. Obviously, with older kids, they're much more aware of potential violence at school. And, I hear about this in my practice as well. And so it's a whole different talk.
I know Americans overall, when you look at the statistics, are reporting feeling frustrated. They're angry with the political gun debate. No one seems to know what to do. I think you feel helpless here. How do people cope with these types of feelings?
I see it also in my practice where kids are completely immune to it. It's almost as if they just accept it as a part of their daily experience. And it's really sad. It's really, absurd. But I think, look, one of the things that's super important for kids that are older, as well as us as parents, is to take a step back and do an assessment. The idea that any of us should have to live with these conditions it's completely unreasonable. And you would wish that our leaders would do something in order to protect the safety of kids and families and just even people on the street. But if you step back and you take a look at this, the actual stat in terms of how likely you are to experience something like this, it's very, very rare, and it's very, very uncommon. And so oftentimes with younger kids, where you're reassuring their safety, with older kids, you're kind of delving more so into the likelihood that something like this would happen, as well as talking to them about how to protect themselves in situations like this. An assessment as a parent is very important. If as a parent you watch these stories and you think that this is imminent, that it could happen at any time, that anxiety you have is going to filter down to both the older and younger children. So I think it's really important to step back, look at the likelihood that something like this could happen, really assess. By the way, if they're in danger, then don't put them in a situation where they're in danger. But if they're not in danger, make sure that your anxiety is under control so that they don't have to deal with their anxiety plus yours.
That's a good point.
I think, and I think the other thing too is it's so important, like with these older kids, that you listen. Oftentimes they just want to be heard. They know there's really not a solution. They know that this is a reality of living in today's world, especially here in the United States. But they want a partner in this. They want somebody to keep them company so that they're not worrying about this alone.
Oh, acknowledging their fears. Yeah, that's a big one, and presenting the facts. I like that. There's also that broader impact here as well. And we have a new study from Stanford that shows that half of children and teens who are medicated for mental health concerns are only seeing their primary care pediatrician. So with depression, with anxiety on the rise, what kind of change do you think is needed?
I think today more than ever, we feel completely disconnected from each other. If you look back to when our parents were growing up, it was like, ask, not what your country can do for you, but what you can do for your country. There was a pride about being something or being a part of something bigger than yourself. And today, these kids are out on an island in social media. They're judged by how many likes they have or the content that they post. Oftentimes has nothing to do with who they really are as a person. So a lot of times these kids who, they look like they're living happy, healthy lives, down and deep inside, they're feeling completely alone and isolated. And, this is just what we're talking about today. One more thing that these kids have to worry about. Especially here in Los Angeles, you find that two people have to work. Divorce rates are very high, so maybe they're in the home with one parent. So the idea that they're really connecting with their parent over dinner, or they have a place to connect with their parent and talk about stuff like this, it actually is rare, and that's the sad part. So I think we need to make time for them and really be connected with them and help them to feel connected so they're not alone in this world.
I just want to hug all the
I
kids and
know.
making sure everyone's okay. And
Yeah.
that is hard, right, in our busy lives. Dr. Swanson, thank you so much for being here. Great insight to take back home with all of us this morning. So thank you.
Thanks, guys.